Hello, everyone. This is Michael Misko with Misko Health Law with this week's installment of Cairo Secure's Growth Without Risk lecture series. And this week, we're going to talk about the HRSA recoupment of COVID 19 provider relief payments. The These payments were authorized under, I believe, the CARES Act, but they were part of the COVID-19 relief bill. And essentially, what happened is, as I'm sure it happened to many of you, when COVID kicked in, practices are shut down, elective services aren't allowed to be performed. Um, it put outpatient providers in a real pickle because they had no patients coming in and no income. So what happened is that Medicare essentially just started pushing out these funds prior to letting anybody know what strings were attached to them. So there are as many as 10,000 physicians that received these funds during the pandemic that are now being asked to refund those monies because of non-compliance with the air quotes strings, and they're on the hook for as much as $100 million. Now, I don't imagine some of the bigger ones, they're hitting physicians for $250,000 recoupments. I don't imagine that's going to be an issue for anybody on the call or listening to this program because the scope of your Medicare billings aren't likely that large. However, the way that they calculated it is that in phase one, there was a $30 billion distribution. And the way they figured it out is they took your Medicare, the total payments that you received in 2019 from Medicare, divided by 453 billion, which is the total amount they spent, to figure out what your pro rata share of the total spending was in 2019. And then they multiplied that factor by 30 billion, which was the amount of the relief package. And that led to payments being issued to providers, and these were payments that just showed up in their accounts. Physicians didn't have to ask for them. They just simply called me one day and said, "Hey, this money showed up. What's it for? What do I do with it? Do I have to give it back? Uh, what's going on?" Now, there were terms and conditions that you are deemed to have accepted if you didn't contact HHS with objections within 90 days of receipt of those funds. The only problem is that the information about these payments on the CMS website, providing the links to what the terms and conditions were, didn't go up immediately. So the funds definitely preceded the rules because they were in a hurry to get funds out to physicians so that they could stabilize and keep their practices open. Now, there were a number of key obligations in those terms and conditions, and I'm not going to review them all. They're available on CMS's website, and there's a document that's available to you for download that will explain all of it to you. But one of the key certifications is that the providers that receive this money have to use the funds to prevent, prepare for, and respond to coronavirus. And they're only to reimburse the recipient for healthcare related expenses or lost revenues that are attributable to coronavirus. So this created an accounting problem for small practices because, to the extent that they purchase PPE, the expense associated with wiping down tables and doorknobs and all the things that you did um, where you were permitted to keep your practice open, and then lost revenue. And understand it's not lost revenue overall, it's lost Medicare revenue. So if you didn't have a lot of Medicare revenue to begin with, then it's hard to claim much of a loss in that respect. But usually, to the extent that you had expenses, if you were tracking them, then and could show that you used that money to pay for those expenses, that was one of the key requirements. Um, you will not you also certified that you would not use the payment to reimburse expenses or losses that have been reimbursed from other sources. So if you got, some of the either the SBA money, or you got payroll protection, and things like that, you had to offset how you use those monies in relation to uh, any additional losses that you sustained because of COVID. And then you were required to submit reports to the secretary, um, that for each, as we're going to see in a minute, there are a number of reporting periods, and with each period, you had to submit reports establishing how you spent the money and therefore your entitlement to keep it. And it was the failure to submit those reports that is why providers are being asked to refund this money. So, looking at the reporting requirement, if you received more than $10,000 in a particular reporting period, then you were required to report for the how detailing how the money was spent in that period. So, they Medicare gave us a table which should show up on the screen here shortly. There it is. And you can see that the first reporting period for payments that you received between April 10th, 2020 to June 30th, 2020, um, then you had those funds available, and then the reporting period ended September 30th, 2021. Now, a little asterisk indicates that they did extend it to the end of November, but nonetheless it's over. So if you got money during period one and it was more than 10,000 and you did not submit a report, you're likely going to get a request to refund that money. The second period is July 1, 2020 to December 31, 2020. And you could use the funds anywhere from January 2020 to December 31, 2021. The reporting period just ended at the end of last month. So if you got money in the second period and you didn't report and it was over $10,000, expect that uh, the government is going to ask for that money back. And as you can see, there's up to 5 reporting periods. Although I think they're out of money, so I'm not sure if there's going to be any further distributions. I just read this morning that there was a joint agreement between the House and the Senate to a much smaller COVID package that would extend coverage for things like testing and whatnot. But I'm not absolutely certain because I haven't read the bill as to whether there's any additional provider relief payments involved there. So we know that the phase one and the phase two reporting deadlines have passed, and from that perspective, if you've gotten that money you didn't report, then I would anticipate that if you have not received, you will soon receive a request for uh, refund of those monies. So what do you do if you missed your reporting deadline? So if you got those payments, verify first that you complied with the rules relative to how you spent the money. So start gathering all your receipts for what you purchased in terms of PPE, staff time for cleaning rooms and tables, and if you had contractors in to fumigate or do whatever in order to keep your practice open during the permissible spend period, then that information will demonstrate that you spent the money correctly consistent with the terms of the act, and that the only issue here is a technical one in terms of the failure to report. um, and if you did not report, you have two options. You can either voluntarily refund the money, and I would suggest that option, especially if you didn't spend it the right way or can't demonstrate that you spend it the right way. You should voluntarily refund the money, even if you got less than $10,000. So uh, let's unpack this. If you got more than $10,000, you have a reporting obligation that if you didn't meet, they're going to want to recoup the money. But if you can demonstrate that you spent the money correctly, then I think there's a possibility for appeal. If you didn't, let's say you got less than $10,000, so the reporting requirement isn't going to kick you in the teeth, but let's say you can't substantiate that you spent the money properly. Or let's say you used it to pay staff or whatever you used it for. Um, in that circumstance, and you can't demonstrate the lost earnings and whatever, then to substantiate the payment, then in that circumstance, this is where the reverse false claims provision of the False Claims Act comes into play, where because you've got money or you receive money that you're not entitled that you weren't entitled to keep, let's put it that way, because you didn't spend it the right way, then you have an obligation to voluntarily disclose and refund that money back to the federal government. And failure to do so, if they identify it, could subject you, excuse me, to False Claims Act liability for the failure um, to refund those overpayments back to the federal government. And the way that works is normally when you think of fraud or False Claims Act liability, it's based upon some overt action that you do. You misrepresent a service or you bill stuff that you didn't do, things of that nature. You bill upcode services or use modifiers improperly. Um, in the reverse False Claims Act sense, claims or money that you receive becomes a false claim by virtue of the fact that you know or should know that you're not entitled to keep the money and you don't give it back to the government. And the False Claims Act has some pretty stiff penalties. It subjects you to treble damages. So let's say you got $2,500. Now you have to refund $7,500. Plus, there's a punitive sanction of, I think it's up to, it varies by the cost of living index, but um, I think it's up to $22,500 per claim. So this would fortunately be a single claim, but nonetheless, over a $2,500 overpayment, you would be looking at possibly $35,000 and potentially being decredentialed from Medicare or being added to the exclusion list. So the penalties are pretty significant. So if you got a magical deposit that you don't know where it came from, um, during those periods, and in your usually those were direct deposited to your accounts, and you think, hey, free money, yay, you might want to go back and look, and validate that whether the source of that money was Medicare, it was one of these provider relief payments, and if it was, look into how you spent it, or how you can justify that you were entitled to keep it first and foremost, and then secondarily whether you met the reporting requirements. If you get a recoupment, that is subject to appeal, and it's possible that if you appeal and demonstrate that you spent the money appropriately and you just merely failed to report, that you could get that recoupment overturned. So that's all we have time for today. Next week, Dr. Sam Collins will be back with some coding related information. And until next time, have a great day.